Okay, no questions. All right. So now I'd like to introduce Dr. Dorene Rentz, who volunteered to be our speaker today. Many of you already know her. She is a professor of neurology at the Harvard Medical School and a clinical neurologist with dual appointments in the Departments of Neurology at the Brigham and MGH. She serves as the co-director of the Center for Alzheimer Research and Treatment and the director for the Outreach, Retention, and Engagement Core at the Massachusetts Alzheimer's Disease Research Center. She is also a clinical core leader for the Harvard Aging Brain Study and a co-leader of the Clinical Outcome Instrument Unit of the Alzheimer Clinical Trial Consortium. Her research focus has been on the early detection of preclinical Alzheimer's disease, particularly in high-functioning individuals. Her recent work involves exploring early cognitive changes using PET, amyloid, and tau imaging. And more recently, she is the leader in cognitive outcome assessments for secondary prevention trials in preclinical Alzheimer's disease, and has explored the feasibility of using technology to do cognitive assessments in the clinical and home environments. Welcome, Dorene.
Thank you, Martha. I hope everyone can hear me okay. I obviously am speaking from home. This is my husband's office. If you hear the garbage truck outside, I apologize. Or we have cats who meow, and you might hear that as well. So these are some of the hazards of doing this in the home environment. But welcome all of you. I know that it's a treat to be able to speak to you. And unfortunately, I wished it was a better environment where we would not have to be doing, we could be doing this in person rather than over Zoom like this. So anyway, I'm going to say hi from everybody at the Harvard Aging Brain Study. As you know, we've been working remotely from home and keeping very busy. You folks have been so generous in participating in the Harvard Aging Brain Study, sharing all of your data with us, cognitive imaging, blood biomarkers, and we've been really trying to focus on getting this analyzed and this work out to be published. So we can't thank you enough for being a part of our family at the Harvard Aging Brain Study. So today, you know, when Martha asked me to do this talk, I know that many of the investigators that you've heard from have talked really about the work that's a part of the Harvard Aging Brain Study. And I'm going to be doing some of that as well, but I thought maybe you'd want to hear about when memory changes are not Alzheimer's disease and how do you tell the difference. I know that in the Harvard Aging Brain Study, we kind of focus on Alzheimer's, but I want you to know that there are many other causes of cognitive or memory change besides Alzheimer's disease. And I thought maybe this would be something that you might be interested in hearing about. So what is normal aging? I'm going to reduce this thing here so that I can see my own slides. So how many of you actually say, who's that movie star? What's the word that I'm looking for? Where did I put my keys? Where did I park the car? What did I come in here for? And what was I going to do? I think all of these things we all have experienced at one form or another. And I just want you to know that these things are actually normal. So if you have trouble coming up with the names of famous movie stars that you're watching on TV, and now we have a little bit more time for Netflix than we have before, know that this is pretty much a common experience among all of us as we get older. In fact, one of the most common things that people worry about is not being able to remember what they went into a room for. They have to walk back out and come back in. And that too is all part of normal aging. But what kinds of things can we expect as we get older? You know, I'm almost 70 years old myself, so I kind of have a little insight into what many of you are experiencing. But one of the things that it's important to know is that there are certain changes that are very much a part of the normal aging process. One of them is that we don't think as quickly as we used to before. Our processing speed gets slower. We're going to have difficulty coming up with words that we find this to use in conversation. We call it the tip of the tongue phenomenon. And I know that as I've gotten older, and particularly at the end of the day when I'm coming home and I'm trying to tell my husband something, I have a very hard time coming up with the exact words that I want to use. And I often say, well, that thing, and he says, you got to tell me what that thing is. And I know that it's not something to worry about. It's something that's very much a part of the normal aging process. Also, our hearing and our vision begin to diminish. Our ability to manipulate information in mind. I used to be able to hold 25 balls in the air at the same time. And now I realize that I'm lucky if I can do 2 or 3 things and maintain that kind of mental flexibility. Our reaction times are also getting slower. But the good news is that there are some things that are actually getting better as we get older. And one of them is our reasoning skills, our vocabulary abilities, and actually our overall sense of wisdom. If there's one advantage about getting older is we've gotten wise. And none of that is going to go away with the normal aging process. But the question that you often hear is memory loss inevitable? What is memory? You know, many people have this notion that memory is like a video recorder, so that if you remember something, you can remember it in all the vivid detail as if you had taken a video of it. But we know that that's really not true. There's plenty of literature and research out there that talk about false memories or eyewitness testimony and the unreliableness of eyewitness testimony, because our memories are not like a video recorder. Um, Dr. Loftus down at the University of California and at UC Davis has really shown that if somebody is involved, even in a salient accident, they may think that they remember a stop sign was there or this was there or that was there. And then when you really do go back to the scene, none of that stuff was there. So our memories are not like a video recorder. We're not expected to remember every single detail. In fact, our memories are kind of like puzzle pieces. So the wonderful thing about memory is that once we try to remember something, we're actually associating it with something else that we are familiar with, so that all these associations kind of fit together, much like that puzzle over on that one side of the page. But we also know that our memories aren't just in one location in the brain, like the hippocampus. In fact, our memories actually get scattered throughout the cortex. And every time that we retrieve a memory, that we recall it another time, it actually then gets restored, not necessarily in the same place. And that is why memories actually get distorted. Because if we've associated it with one thing at one point, and then we retrieve it and we associate it again with something else, then the memory is been changed in one way or another. This is the normal way that memory works. So this is not Alzheimer's disease. This is just normal memory. So if you feel like, in fact, sometimes when I go home to my twin brother, he'll say, well, don't you remember it was this way? And I don't remember it that way at all. And it's because our memories have been consolidated in very different ways, his with his memories and mine with my memories. And as neuropsychologists, we've learned to stage memory in different ways. So we have stages of memory called encoding, which is learning information. And those of you who have done the Harvard Aging Brain Study for many years know that we'll give you a list of words that we ask you to remember, and that's the learning stage. You're actually taking in the information. In order to take it in, you got to be attending to it. You also have to be hearing it. So sometimes people say they forgot, but they never really heard it in the first place, or they never really learned it in the first place. Then that information has to get stored. So like you saw in the previous slide, it gets stored into around various different parts of the brain with other memories that are familiar to it. And then eventually you got to be able to get it out when you want it. So these 3 stages of encoding, storage, and retrieval are really critical for remembering things and for analyzing whether your memory is normal or not. As a neuropsychologist, I actually will assess all 3 of those stages. How well did they get it in? How well did they store it or consolidate it? And how easily are you able to get at that information when you want it? Now, as a part of normal aging, we usually don't have any problem learning or storing information. Where we have a problem often is getting at it when we want it, so that we have this notion that we know what we want to say, we just can't say it initially. Or somebody will say, well, don't you remember? They'll give us a cue and they'll say, we went to such and such a place, and then all of a sudden the memories come tumbling back. That is very much a normal process of memory in aging. But when does memory become worrisome? And some of the symptoms of early memory loss are when all of a sudden we become lost in familiar places. So one of the very earliest signs of Alzheimer's disease is someone would be driving and then not remember, sorry.
I believe Dorene is, okay, perfect.
In order, yeah, thank you. See, these are the hassles of doing this on video, so pardon me, please. So one of the very early signs is getting lost in familiar places. I heard, I had a patient who said that they used to go to the movie house every week, and then all of a sudden they couldn't go to the movie house anymore. They got lost getting there, or they couldn't remember how to get there. This is a very serious change in our memory, and we need to be paying attention to that if we're becoming lost in familiar places. Another common event is when someone is riding down the expressway and then all of a sudden miss their exit. And not because they were being inattentive or listening to something else, it's because all of a sudden they didn't recognize a familiar place. That's worrisome, and when that kind of thing happens, we want to be able to seek medical attention. The other thing that's common when memory is not normal is asking the same questions repeatedly. Where was that? What did we do? What did you say? Where are we going today? And we need to pay attention to when those kinds of events are occurring as well. And then finally, when you forget recent events or details of conversations. I think many of you know my husband has early Alzheimer's disease, and that was the thing that really pushed me over the edge, that things were not normal for him, was when there was a salient event about a Christmas gift, and he had no recollection of this gift at all, and how our son gave it to us. And so these are the kinds of things you want to pay attention to when memory is not normal. And I think one of the most feared consequences that all of us have as we get older is, are we going to get demented? And one of the common questions I hear all the time, well, how is dementia different from Alzheimer's disease? A dementia is really the umbrella term that actually encompasses many types of pathology that can cause a dementia. A dementia is really a clinical syndrome, and that is reflective of the underlying pathology that's occurring in the brain. So Alzheimer's disease, as you can see over here, is really the most prevalent form, and it will create a deterioration in your ability to function, to remember, and that actually becomes the dementia syndrome itself. But there are many things that could cause a dementia. Alzheimer's is just one of them. You can have a dementia due to little strokes or vascular disease. You can have a combination of dementias like Alzheimer's or vascular dementia. And then there are a few that are a little bit more rare. We'll be talking about today, Lewy body disease or frontotemporal dementia, or there are many other types of dementing syndromes, and some of them even reversible. So we'll be talking a little bit about all of that today. But since most of you are in the Harvard Aging Brain Study, you know that one of our main focus is to try to understand normal aging, and that's that red line there, but then to really understand the earliest changes that differentiate normal aging from early Alzheimer's disease. And so our focus, and one of the main reasons why you take all of those PET scans, is for us to look at the underlying pathology called preclinical Alzheimer's disease. And I think many of you have probably heard that these changes in the brain are occurring 15 to 20 years before you become forgetful or receive a diagnosis of mild cognitive impairment or dementia. And that is one of the main reasons why we started the Harvard Aging Brain Study, is that we wanted to understand this very early phase. And as you know, our fearless leader, Dr. Risa Sperling, she has been really on the forefront of understanding that if we're going to treat this disease, we have to treat it at this preclinical phase. Because once you go down that blue line into the area of mild cognitive impairment or dementia, so much deterioration in the brain has already occurred. So if we're going to treat it, we're going to treat it early. And each and every one of you, as a part of the Harvard Aging Brain Study, have really been pioneers in helping us forge this understanding of the preclinical phase, and really have led us to the prevention trials that are currently ongoing now. So I can't thank you enough for all that you folks have done to really help us understand this preclinical phase of Alzheimer's disease. So what is Alzheimer's disease? Many of you probably know it started with Alois Alzheimer when he met Augusta Dieter in the Frankfurt Asylum in 1901. Poor Dr. Alzheimer, who had this disease named after him. But when he met Augusta Dieter, her husband brought her to the asylum saying, she doesn't recognize me anymore. And he realized that what she was going through was not what they typically see in the asylum, that in those days they called schizophrenia. So we followed her over time. And then in 1907, when she passed away, he opened up her brain, and he found, as you can see here, these amyloid plaques and neurofibrillary tangles, which became the hallmarks for Alzheimer's disease. When you do your PET scans, these are the things that we're looking for. Your amyloid scan is going to try to find these plaques, and your tau scan is actually looking for these tangles. And we're trying to see the earliest changes that are going on in the brain in relationship to Alzheimer's disease. And I think many of you are involved in this study because you've known people who have had this disease. You know that it involves problems with memory It involves changes in naming and thinking. There's a deepening confusion, a loss of insight. And then later on in the disease, there's a growing apathy and withdrawal, sometimes changes in mood and behavior. And unfortunately, it's slowly progressive over years. But when we look at memory in Alzheimer's disease, what we find is that people have a hard time learning information, obviously storing it, and getting it out over time. So when we evaluate people with Alzheimer's disease, what we notice is that if you give them a cue, and you know in normal aging, you get a cue and all the information comes pouring out. But in Alzheimer's disease, it's like they never heard it in the first place. That's why they ask the same questions over and over again. So when are we going? Where are we going today? What are we doing? Because the information never gets in, it never gets stored, and obviously then it can't be retrieved either. But Alzheimer's disease isn't the only thing that causes cognitive and memory changes. In fact, probably about 25 or 30 years ago, the most common cause that we were aware of was strokes. People having strokes or having vascular disease. And now we know that these kind of vascular changes produced by high blood pressure, diabetes, high cholesterol, sometimes a genetic or family history of stroke, smoking, unhealthy diet, all of these things can produce the kinds of changes that you see in the brain, as you see in the brain down here in the at the bottom corner. You can see that there's all that white stuff is not normal. That is oxygen deprivation in the brain that's creating a neuronal loss. So that once you have a cut in the connection of these neurons, then the information can't flow through, and obviously it's going to produce these little strokes. Now, the good thing about strokes or vascular disease is that we have treatments for them, unlike Alzheimer's. We can control our blood pressure. We can control our diabetes and our cholesterol. And we know that these are critical factors for maintaining a healthy brain and a healthy heart. And so how do you prevent vascular disease? Don't smoke, stay physically active, choose a healthy diet, and actually follow treatment prescribed by your doctor. These are all really critical. The other thing I remember when I was a young doctor at the Rehab Institute, back in those days when people had a stroke, they could recover, but then they might have a second stroke. And then what happens is that the more strokes you have, the more cognitive deterioration you experience. Today, if you have early warning signs of a stroke, you get yourself to the doctor right away, and there are medicines that they can actually give you in the emergency room to help reverse that process. I'll talk about that in just a second, because I know I have a slide on that as well. But what kinds of cognitive changes occur with vascular disease or stroke? It's different than with Alzheimer's disease. Frequently, it affects networks in the brain that are responsible for our ability to attend and to concentrate, which is one of the main reasons why memory problems are really at the level of learning and getting it out. But what's interesting is that as you are trying to remember something, frequently the information actually does get stored. I remember once being a consultation liaison doctor on the inpatient ward, and this one woman was actually in a confusional state. And so at the time, I didn't think that she was remembering anything at all. And I was asking her to remember apple, table, penny, the 3 words from the MMSE. Of course, she couldn't get it in. She couldn't store it. She couldn't get it out. But then the next day, I went back and she said, "Oh, you're that doctor that wanted me to remember apple, table, penny." I was blown away, because it really brought home to me how even when we don't think we're paying attention, that information sometimes can actually get stored in the brain. Now that is very different than with Alzheimer's disease, where things just aren't getting in and there's a rapid rate of forgetting that information. With strokes, the information may actually, those networks that are responsible for memory may actually be preserved. What is dysfunctional is that ability to get it out when we want it. And that's a different part of the brain. I put this in here because we don't talk about stroke very much anymore. And yet I know that when we get older, sometimes you have some of these symptoms. And these are symptoms that you should not ignore. One is if you're experiencing weakness or numbness on one side of the body. Sometimes these things are very transient. Many times people will have these little strokes while they're sleeping. Or they'll have it during the day, and sometimes in 30 minutes it's resolved, but you want to be able to get to the doctor if you're having any of these experiences. Even during COVID-19, you want to be able to get to the emergency room and attend to these symptoms. Some people will have a droop in one side of the face, as you can see here. Difficulty reading or understanding speech. Their speech will be garbled. Their speech could be slurred. Or you could have a severe headache. Or maybe you're not being able to see out of one side of your eye. You'll see some neglect, or you'll have trouble walking. These are 7 signs that you should not ignore and you should really seek medical attention for. Because one of the other things we know is that while some of these things can affect the brain, there is recovery, and you might be able to stabilize and go back to your baseline functioning. I'm sure there are people listening who may have actually even experienced something like this. But these are symptoms you don't want to ignore. Another change as we get older, or another neurodegenerative disease, is Parkinson's disease. And you know that Muhammad Ali and Matthew J. Fox have Parkinson's disease, and now Alan Alda has Parkinson's. And this is caused by a buildup of alpha-synuclein deep into the brain. But these are symptoms that create rigidity, tremor, stoop posture, shuffling gait, masked faces. That means that their face is just bland, like you see in Muhammad Ali and also in Matthew J. Fox. And it does produce some changes in cognition, slowed mental functions. Your memory problems are very similar to the problems that you see in vascular disease. But what is also important to know is that Parkinson's disease may also have additional pathologies such as Alzheimer's or Lewy body disease. And I just want you to know that this is another thing that you should not ignore and seek medical treatment for. And then one that came, another dementia that came to light with Robin Williams is dementia with Lewy bodies. And it's also important to know that many African Americans who have a dementia may have a combination of Alzheimer's plus Lewy body disease. Some of our research pathologists have said. Now, the interesting thing about Lewy body disease is that it frequently has plaques and tangles of Alzheimer's disease as well. But the symptoms are very different. I've had the privilege of evaluating a number of people who have had this disease. And one of the defining features is these visual hallucinations. There's a condition called the REM behavioral sleep disorder. So it's a condition in sleep in which you're not going through all the stages of sleep, but rather there's a section of REM sleep that's very close to consciousness. And it actually produces what we call visual hallucinations. These visual hallucinations are not the kind that you would see in psychosis or schizophrenia, where you could see bugs on the wall or something like that. In fact, they're not scary. Usually, they're seeing people that have passed on already or are familiar to them, and they're not scary to them. Also, many people who have these things know they're not real, and they're not worried about them either. Um, Also, along with Lewy body disease comes fluctuations in alertness. So frequently, they may know an answer to something at one point, and then a few minutes later, not recall it at all, or vice versa. They may not know something now, and then a few minutes later, they know it. And you see these fluctuations that are occurring in their level of alertness and attention. And of course, the other main thing is that they have the same motor symptoms that you actually see in Parkinson's disease. So I just wanted you to know that there are many other kinds of dementing syndromes that are occurring in addition to the pathology of Alzheimer's disease. And it's important to know the difference so that you don't ignore these symptoms. And this last one here, frontotemporal dementia, usually affects people earlier in life. But it creates a behavioral change that even precedes changes in cognition and memory. Sometimes this behavioral frontotemporal dementia could affect your language, or it could affect your movement. And you can see the red on the screen of the brain where a lot of the pathology is really at the front part of the brain, where in Alzheimer's disease, it's in the middle and toward the back of the brain. And the other thing to know that's very different than Alzheimer's disease is that it really impacts your social skills. You lose all awareness of the social appropriateness. Your personal conduct changes. You do things or say things that you never would have said otherwise. And there's obviously reduced self-awareness. There's a lack of judgment, a disinhibition, and many times neglect of hygiene, compulsive, repetitive, or apathetic behavior. Now, some of these changes really occur also much later in Alzheimer's disease at more moderate to severe stages, because by then the pathology is affecting the front of the brain and producing some of these changes as well. But probably for most people in the audience today is we're probably too old to get this disease at this point, but it is important to know that this type of behavioral variant, frontotemporal dementia, also exists. And you should also know that there are reversible causes of dementia. So this means that people might actually get a diagnosis of dementia when really there's a treatment for it, like depression. Sometimes you can get so depressed that it looks like as if you're demented. Medications can create what looks like a dementing illness. And urinary tract infections can really produce confusional states that look like a dementia. I always warn older women that we're prone to this kind of thing. And I remember my mom used to get these urinary tract infections. She would go to the, if she didn't go to the doctor, they would put dementia in her chart. And I knew she wasn't demented. I knew that she had this confusional state. You give some antibiotics and then she would pop right back out to her baseline. So it's important to know that some of these things can really be treated and reversed. Vitamin deficiencies can create what looks like a dementia. Hormonal dysfunction or thyroid problems can do that. Tumors and, of course, any kind of alcohol or substance abuse can cause people to look demented. So know that when you go to your doctor, not everything is Alzheimer's disease, that you want to make sure that your doctor does a thorough investigation, takes blood work, and really rules out all of the reversible causes that might produce memory loss or cognitive change. And then another big one, and many of you have seen the commercials on this, is normal pressure hydrocephalus. The normal pressure hydrocephalus community say it looks like Parkinson's, acts like Alzheimer's, but that there's a difference, it's actually treatable. Now what happens is, as you can see in the normal brain there, that your ventricles should be small. But when you have hydrocephalus, there's some obstruction that's going on, or the cerebral spinal fluid is not being absorbed properly, and it will create this huge volume of cerebral spinal fluid in the middle of your brain. And as a result, it's pushing out the function of all your neurons, which creates then sometimes a stooped posture, urinary incontinence, memory changes. And I've evaluated a number of people who've had normal pressure hydrocephalus. You can put a shunt into the brain, the cerebral spinal fluid is drained, and all of these symptoms can disappear. So again, if not everything when you go to the doctor is Alzheimer's disease, you want to make sure that they rule out hydrocephalus as well. And then finally, can we delay or prevent dementia? I think that's the question I get all the time. Well, doc, what can I do? And this is what you can do. Now, I'm not going to tell you anything your doctor hasn't already told you. Physical activity. You know, we're in this COVID-19 pandemic where we're quarantined, but you know, get out and still walk around the neighborhood. Sometimes it's hard for me to do that because I'm doing Zoom things like this, but I try to get out every day to at least walk around the block. Pay attention to your diet. More fish and olive oil and less fatty foods are really important for maintaining a healthy brain. And this is kind of hard. We need to maintain social activity, family, friends. And we have had some wonderful investigators in the Harvard Aging Brain Study who have looked at the impact of social activity, and reductions in that activity can be associated with increased amyloid burden. You want to also stay cognitively and intellectually active. You want to pay attention to your sleep, manage your stress, make sure you're not on the wrong medications, and overall maintain your health. That a combination of all of these things is really helpful, not only for the brain, but also for the heart, and also for maintaining good cognitive awareness. Jenny Rabin in the Harvard Aging Brain Study, she actually took some of the data that you guys have produced, all the pedometers you wore, and she looked at the physical activity and its impact on the production of amyloid in the brain. And what she found is that those people who were able to maintain greater physical activity, now she says 8,900 steps a day, I've heard 6,000. I've heard 4,000 steps a day, but it's in addition to getting out there and walking, you can see that yellow line. If you don't do it, your cognition is beginning to decline. And on this other side, you have more amyloid in the brain. So greater physical activity, managing your heart health will reduce cognitive decline and may actually have a positive impact on the pathology in the brain. And so finally, I want to say that all of you have helped us to make advances in the Harvard Aging Brain Study. And the good news is we've been renewed for another 5 years. So we just got the notice that we can move on. And some of the things that we're doing is we're going to continue to work on the digital pen. Some of you have seen the digital pen. You've drew clocks, you've gone through mazes, you've done digit symbol. We're analyzing that data. And in fact, a paper that I've written on the data that you've helped us with for a digital pen will probably go out sometime this week. But Dr. Kate Papp and Rebecca Amarillo are working on new mobile tasks. Aubryn Samaru has also been a part of developing what we call Branch. And these are a new set you can see of cognitive tests that we're actually putting on a mobile phone. And we're hoping that some of this new technology, if we ever have another pandemic like this, we're not losing out on the cognitive data that we can be collecting, because you'll be able to do it in the comfort of your own home. We're also going to be looking at the earliest brain changes on PET. You'll be asked to participate probably in some more newer or novel PET scans with Dr. Keith Johnson. Dr. Jazz Chatwell is going to be exploring more vascular inflammatory processes, because we know that Alzheimer's disease is not merely plaques and tangles, but it does involve some inflammation that's going on in the brain. And right now, we don't have a way of really examining that that's realistic and reliable. And the other big thing that we're going to be pursuing are blood-based biomarkers, so that eventually you wouldn't have to go through PET scans in order to understand amyloid or tau levels in the brain. And right now we don't have any reliable blood-based biomarkers, but we're hoping in the next 5 years, if you guys can hang in there with us, that we'll be exploring the value of these as well. So that's all I have to say. I'm open to questions. I, again, want to thank everybody in the Harvard Aging Brain Study who I get a chance to work with every day. And I can't thank you all enough for being a big part of advancing the field of Alzheimer's disease. And one day we will find a treatment. I'm confident of it. So thank you very much.